Tuberculosis. The very word evokes images of a bygone era, a disease of poverty and neglect. Many believe it's a relic of the past, eradicated by modern medicine. This is a dangerous misconception. TB, though often overlooked, still casts a long shadow across the globe. It remains a silent epidemic, a threat to global health that demands our attention. This video will delve into the reality of tuberculosis, exploring its causes, symptoms, treatment, and the crucial role of prevention and awareness. The truth is, tuberculosis is a complex disease, often misunderstood and misdiagnosed. Its impact extends far beyond individual sufferers, affecting families, communities, and entire nations. It's time to shed light on this often hidden disease and empower ourselves with knowledge. Despite advancements in medical science, TB continues to be a formidable adversary. It adapts and evolves, often outpacing our efforts to control it. The fight against tuberculosis is not just a medical challenge but a social one as well. It requires a concerted effort from governments, healthcare providers, and communities worldwide. Awareness and education are key in dispelling myths and encouraging early diagnosis and treatment. Effective treatment is available, but it must be accessible to all, especially in underserved regions. Support systems play a crucial role in the recovery process, providing emotional and practical assistance. Together, we can overcome the challenges posed by tuberculosis and move towards a healthier future. By unmasking this misunderstood disease, we take the first step in eradicating it once and for all. Tuberculosis, or TB as it's commonly known, is caused by a bacterium called Mycobacterium tuberculosis. These microscopic invaders primarily target the lungs, infiltrating the delicate tissues responsible for breathing. Imagine a silent thief slipping into your home and slowly dismantling it from the inside. This is how TB operates within the human body. Once inside the lungs, the bacteria multiply and can cause inflammation and damage. While the lungs are the primary target, TB can also spread to other parts of the body, including the kidneys, spine, and even the brain. This makes TB a formidable opponent, capable of wreaking havoc on multiple organ systems. One of the most insidious aspects of TB is its mode of transmission. It spreads through the air, invisible and often undetected. When a person with active TB coughs, sneezes, sings, or even speaks, they release tiny droplets containing the bacteria into the air. These droplets can linger for hours, particularly in enclosed, poorly ventilated spaces. It's important to note that TB is not spread through casual contact. Touching, sharing food, or kissing will not transmit the disease. It's the inhalation of infected droplets that poses the real danger. This airborne nature of TB makes it a significant public health concern, particularly in crowded living conditions. Tuberculosis is often called a silent disease because its symptoms can develop gradually, often mimicking other illnesses. This makes early detection difficult, as people may dismiss the signs or attribute them to something less serious. However, recognizing the symptoms of TB is crucial for seeking timely medical attention and preventing further spread. A persistent cough that lasts for more than 3 weeks is one of the most common symptoms. This cough may be accompanied by coughing up blood or phlegm. Other telltale signs include fever, chills, unexplained weight loss, fatigue, night sweats, and a general feeling of being unwell. If you experience any of these symptoms, especially the persistent cough, it's essential to consult a healthcare professional. Section 5. Diagnosis and treatment: a battle plan for recovery. Tuberculosis, commonly known as TB, is a serious infectious disease that primarily affects the lungs, but can also impact other parts of the body. Understanding the diagnosis and treatment process is crucial for recovery. Diagnosing tuberculosis involves a combination of tests. These tests are essential to accurately identify the presence of the TB bacteria in the body. A skin test or a blood test can detect the presence of TB infection. The skin test, also known as the Mantoux tuberculin skin test, involves injecting a small amount of tuberculin into the skin and observing the reaction. The blood test, on the other hand, measures the immune system's response to TB bacteria. If these tests are positive, a chest X-ray is usually performed to confirm the diagnosis and assess the extent of lung involvement. The X-ray helps to visualize the condition of the lungs and identify any damage caused by the infection. Early diagnosis is key to improving treatment outcomes and preventing further transmission. Detecting TB at an early stage allows for timely intervention. which can significantly reduce the risk of complications and the spread of the disease to others. The good news is that TB is curable with appropriate treatment. Once diagnosed, a comprehensive treatment plan is put in place to ensure the best possible outcome for the patient. Antibiotics are the primary weapons in the fight against TB. These medications work by killing the bacteria that cause the infection and preventing them from multiplying. Treatment typically involves a combination of antibiotics taken over several months. This multi-drug approach is necessary to effectively eliminate the bacteria and prevent the development of drug resistance. It's crucial to complete the entire course of antibiotics as prescribed, even if symptoms improve. Stopping treatment early can lead to a resurgence of the infection and increase the risk of developing drug-resistant TB. Failure to do so can lead to drug-resistant TB, making the disease much more difficult to treat. Drug-resistant TB requires more complex and prolonged treatment, often with more severe side effects. Therefore, adherence to the prescribed treatment regimen is essential for a full recovery and to prevent the spread of this dangerous form of TB. Section 6. Shields Up: Prevention and Control of Tuberculosis. Tuberculosis, commonly known as TB, is a serious infectious disease that primarily affects the lungs but can also impact other parts of the body. Effective prevention and control measures are essential to curb its spread and protect public health. Preventing the spread of tuberculosis requires a multi-pronged approach. This involves not only medical interventions but also public awareness and community engagement. Education about TB transmission and prevention is crucial in high-risk areas. For individuals with active TB, it's essential to cover their mouths and noses when coughing or sneezing, preferably with a tissue that is immediately discarded. This simple act can significantly reduce the risk of spreading the bacteria to others. They should also stay home from work or school until they are no longer contagious. Isolation during the infectious period is a key step in preventing the spread of TB within communities and workplaces. These measures help prevent the spread of infected droplets. Proper cough etiquette and hygiene practices are fundamental in controlling the transmission of TB, especially in crowded and enclosed spaces. Vaccination is another important tool in the fight against TB, particularly in countries with a high burden of the disease. Public health campaigns promoting vaccination can greatly reduce the incidence of TB. The BCG vaccine, while not 100% effective, can protect against severe forms of TB in children. It is especially important in areas where TB is prevalent, providing a layer of defense for the most vulnerable populations. Early detection and treatment of latent TB infection are also crucial to prevent it from progressing to active disease. Regular screening and prompt medical intervention can stop TB in its tracks, preventing further transmission and complications. Community health initiatives play a vital role in TB prevention. By raising awareness, providing education, and facilitating access to medical services, these programs empower individuals to take proactive steps in protecting themselves and others from TB. Ongoing research and development are essential in the fight against TB. Innovations in diagnostics, treatments, and vaccines hold the promise of more effective control and eventual eradication of this disease. By staying informed and supporting these efforts, we can all contribute to a TB-free future. Section 7. The Global Fight: Eradicating TB Together. The fight against tuberculosis is a global one. TB knows no borders, and its impact is felt most acutely in low- and middle-income countries. Addressing poverty, improving living conditions, and strengthening healthcare systems are all essential components of a comprehensive TB control strategy. International collaboration is also paramount. Sharing knowledge, resources, and best practices can accelerate progress towards TB elimination. Organizations like the World Health Organization play a vital role in coordinating global efforts and providing technical assistance to countries in need. Section 8. The Power of Awareness: Early Detection Saves Lives. Raising awareness about tuberculosis is crucial for breaking down stigma, encouraging early diagnosis, and promoting preventative measures. Education campaigns can empower individuals to recognize the symptoms of TB and seek timely medical attention. Community outreach programs can play a vital role in reaching vulnerable populations, such as those living in poverty or with limited access to healthcare. By disseminating accurate information and promoting testing, we can help reduce the burden of TB and save lives. Section 9. A Healthier Tomorrow: Our Shared Responsibility. Tuberculosis remains a significant global health challenge, but it is a challenge we can overcome. By understanding the causes, symptoms, and treatment options for TB, we can all do our part to protect ourselves and our communities. Prevention, early detection, and access to quality healthcare are the cornerstones of a world free from TB. Let us all commit to raising awareness, advocating for research, and supporting those affected by this preventable and curable disease. Together we can create a healthier tomorrow, one free from the shadow of tuberculosis. Thank you for watching. If you enjoyed this video, please like, subscribe, and hit the notification bell for more similar content.